Hello, my name is Millie. I'm glad you came to Respite today to visit with us.
Hi, I'm Mary Beth Meyer, and welcome to the Center for Respite Care. We're a 24-hour medical facility for people who are homeless. We help them to heal, and then we help them on their path out of homelessness.
Hi, I'm Dr. Bob Donovan. I'm the Medical Director of the Center for Respite Care. I'd like to welcome you to our facility. Since we've been doing this, we've seen a wide variety of different illnesses that bring homeless people to our facility. Anything from a temperature of 103 with strep throat to people who are receiving cancer therapies. When I was working on the med van before the respite center opened, I took care of some people who had to take cancer chemotherapy and radiation therapy and then return to the drop-in center. As you can imagine, this is very difficult for somebody and often required them to stop or completely discontinue their treatments, which is a horrible consequence. Now at the Center for Respite Care, we're able to monitor the people that come back from cancer therapies and to give them a safe and restful place to stay during the time which they have their therapy.
Hi, my name's Kenny. I first come to the Center for Respite Care in November of 2003, and I was very hurt physically, emotionally, and spiritually, very sick. When I got to where I couldn't work anymore, and with no health care whatsoever, no insurance, very little resources available to me, I became broke, couldn't pay rent, ended up on the street, and subsequently I had complications. I continued to drink, and I fell and re-injured myself.
A study was done a number of years ago at University Hospital to understand the rate of hospitalizations of homeless people. What they discovered was that homeless people have a very, very high rate of rehospitalization because they're not healing the first time.
When I went to the emergency room, my hand was swollen up. I looked at myself in the mirror and held my hand up to my head, and it was swollen up almost as big as my head. They treated and released me, sent me to the drop-in center with a bus token.
The Respite was formed a number of years ago as a collaboration of both homeless agencies and hospitals. Because of our relationships with all of these many organizations in the city, we actually refer patients to and from virtually every hospital and homeless agency in the city. And by doing that, we don't duplicate services that are already available here in the community. Instead, we use our relationships to help our clients by referring them to these agencies.
Yes, my name is Douglas Smith, and I'm a client of Respite. People who support them, I'm not sure what to say except to encourage you to continue in your support of these people in this house, because they offer tremendous services, not only for the medical recuperation of an individual, but also they try to see to their psychological and their spiritual needs as well. They have Miss Millie Williams is a nurse also. She acts in the capacity as a case manager and assists those of us here towards placement or anything that we need. Respite has a list of sources.
We place people, some of them go to an improved situation as far as shelter, and maybe some of them have come from the street and then they get into a shelter. Very many people have gone out of respite into housing, and when I said housing then I meant their own apartments. Some also have gone to transitional housing, which is a place where some of them can stay up to a year or more and work on issues that have been a barrier for them, or get more education or job training. And other people go to substance abuse treatment because if it's been a very difficult road for them, they need that kind of stability and encouragement and even tough love that they get there to help them get through the substance abuse before they can maintain permanent housing. And we also work on helping people get monies or benefits that they will need to continue in permanent housing once they get there. So whatever they get from respite, we're looking for them to move a step or two up until they get all the way into housing that they can keep and feel good about.